Diversity in healthcare. The Hospice and Palliative Nurses Foundation has received philanthropic support to develop a series of online educational training videos for hospice and palliative care nurses, tailored to cover fundamental considerations of caring for patients of various faith backgrounds. End-of-life care means more than treating physical symptoms. It extends to a patient's psychological, existential, and spiritual needs. Fostering trust is vital to the care of the patient and family during difficult times. In today's changing climate, it's important that we continue to learn about cultural differences. The payoff is significant. Culturally sensitive care builds trust and rapport with patients and families, increases treatment acceptance, and opens the door to continuing education about important health matters within all communities. As part of our series of diversity and healthcare videos, this video was made possible through a grant from the Jack Buncher Foundation. We are honored to live among a vibrant Jewish community of about 16 million people. This community includes many ethnicities, beliefs, cultures, and traditions. The Jewish patients that you will serve will range from spiritual but not religious to those who align their lives entirely with Jewish law passed down through generations. This diversity makes it essential for you to know how to discover the varying needs of each individual. In this video, you'll learn general Jewish concepts and customs that may affect the services you provide as a hospice or palliative nurse. You'll also become familiar with best practices for asking questions that can help you learn about your Jewish patients' beliefs and desires for care. Asking the right questions and understanding the responses that you receive will improve the care you provide. The topics we cover in this video only scratch the surface of Jewish customs. Still, they will help you start asking your patients questions regarding significant ideas, including the Jewish Sabbath, keeping kosher, making medical decisions, coping with the end-of-life experience, and beliefs about an afterlife. These areas of Jewish thought and tradition influence many aspects of hospice and palliative care. Knowing what your patients believe and the practices they observe about each will help you provide improved care. In Jewish tradition, the Sabbath is a sacred day of rest and spiritual reflection that begins on Friday evening at sunset and ends at Saturday evening, also at sunset. Many Jews refrain from certain activities on the Sabbath to honor the commandment in the Torah to keep the day holy. The desire to keep the day holy can influence the patient's behavior and the care that you give them. So on Friday afternoon, consider asking a Jewish patient or one of their family members, is there anything that you would like to share with me about your Sabbath observance or practices that would help me provide better care? To this question, a patient's family member may respond, I know my father is getting close to being discharged. However, I would prefer that he not be discharged until after sundown tomorrow night. Avoiding being discharged on the Sabbath as an example of the way a Jewish patient may choose to keep the day holy. One of the central principles of observing the Sabbath is the prohibition of work, which is defined broadly to include various activities. For example, patients may want to avoid turning on lights or operating electronic devices on the Sabbath, as they may consider these activities to be forms of work. A Jewish patient's activities on the Sabbath will vary from one individual to the next. Ask them about their Sabbath observance so you can act in a way that makes them comfortable with the care that you will provide. So another essential facet to consider when providing care to Jewish patients is the practice of keeping kosher. For some Jewish individuals, maintaining kosher dietary laws holds deep significance, shaping the culinary choices and daily rituals. Keeping kosher has many facets, including preparing, cooking, serving, and eating meat and dairy products separately, eating only certain animals, fish and birds, and ensuring that food, supplies, medications, and vitamins all have kosher certification. Can you think of a question that you might ask a Jewish patient to help you respect their practices concerning keeping kosher? Maybe you could ask, do you keep kosher or have dietary preferences I should know about to best care for you while you are here? So the observance of keeping kosher varies widely between Jewish individuals and communities. So the answers that you will receive to this question will differ. Some patients may adhere strictly to kosher laws, and they'll appreciate your consideration and efforts to accommodate their needs. Asking patients about their kosher practices shows that you respect their choices and you're willing to work with them to make their experience as comfortable and culturally appropriate as possible. In connection with keeping kosher, let's talk about using life-saving and life-prolonging procedures. As patients near the end of their life, they may need to decide to what extent they will accept life-saving and life-prolonging procedures. Using life-saving and prolonging techniques is a topic with several parts to consider. Due to collective and intergenerational trauma, Jewish patients may feel wary of discussing life-saving and life-prolonging procedures with non-Jewish clinicians. They may have concerns about anti-Semitism playing a role in these conversations. Additionally, rabbis are often involved in these aspects of medical care. It may make the patient more comfortable to involve someone they trust in these decisions. You could ask the patient, is there a rabbi or another trusted person who would be an important part of our discussion about eating and drinking at the end of life? As with the other things we have discussed, answers to this question will vary widely depending on the individual and their community. Traditionally observant and Orthodox Jews may view stopping external feeding as hastening death, unless the patient has reached a point where death is likely to occur in the next few days. Some Jewish patients may be hesitant to stop life-prolonging treatments in the case of brain death because they believe in teachings from rabbis about death's link to the moment when the heartbeat stops. Because we live in a time when machines can support heart and lung functions, this may raise questions about when to stop these supportive efforts. As a patient's life comes to its end, some patients may use traditional Jewish rituals related to death to cope with their situation. As they seek comfort, it may be helpful for you to ask, what experiences have you and your family had with death and dying, and how did your community best offer you support? What is helping you get through this? Some people use prayer, humor, or reflection through journaling. What's been helpful for you in the past? You may ask family members, is there a clergy member or a rabbi who you would want to involve in your loved one's care? When responding to these questions, the patient may talk about reciting confessional prayers. One is called vidui. The patient may want a chaplain or family member to assist them. Note that in most cases, Jewish patients are less likely to offer spontaneous prayers, but rather use prayers or blessings that are specific to this life experience. The patient may also ask for someone to recite psalms or other scripture. During their final days, talking with the patient about their beliefs concerning the afterlife may also be helpful. You may ask a patient, have you thought about what happens after death? Have you ever discussed this with your family or loved ones? Is this a concern to you? Jewish views about the afterlife encompass everything from concrete concepts to mystical unknowns. Patients may believe in the idea of a hell that is 60 times hotter than fire on earth. They may believe in a world to come in a messianic age. It's common for patients to have concepts of the afterlife that non-Jewish and secular sources have influenced. Questions about the afterlife may also start a conversation about organ donation. Most Jewish patients accept the mainstream medical consensus regarding death and organ donation. However, you may see some reluctance to organ donation stemming from beliefs regarding physical resurrection in a future messianic age among some traditionally observant patients. As a final note, please be aware of some of the Jewish rituals concerning the time immediately following the patient's death. Within 24 hours of dying, the family or a funeral home will wash and prepare the deceased person's body for burial. Within 72 hours of passing, the family will bury the body in a simple pine box with a white linen shroud on it. During the time between the patient's death and burial, Jewish custom dictates that the body should never be left unattended. So as we conclude, let's take another look at the question we recommended throughout this video. What do all of the questions have in common? Notice how they all use an approach of respectful curiosity. We recommend taking a respectfully curious approach to each aspect of the end-of-life experience. Remember that Jewish patients come from diverse identities, beliefs, and practices. Their answers to your questions are going to vary greatly. Also, remember it's common for Jewish patients to have some intergenerational trauma and experiences with anti-Semitism that may affect their relationship with you. Be patient as you work through the challenges and involve spiritual care colleagues, community clergy, if that's helpful to the patient and their family members.